commitment, which is also important with relationships. So you have to commit. What's up mga dudumog inday? Welcome to my YouTube channel. Please don't forget to hit like and subscribe button down below.
Yo, drop your glasses and shake your asses. I wanna get with you and I feel real nasty. Yo, you make me feel like it was the days out and roll. Let me hold me, shoot it in like you're open. No, you really need this woman.
So hello guys, and I'm happy again to create this vlog today. So what we're gonna talk about today is how I got sick, how it started, tuberculosis treatment, how does TB medicine work, how do you know if TB treatment is working, and important notes when you are still on treatment for TB. So I have my notes with me, and I will only just be discussing the highlight of TB treatment in this video. So if you're interested to know the full details and like the full information about TB treatment, I will be putting the links of the websites that I have been reading in the description box below. So please check it out. In my previous video, we actually have discussed what is tuberculosis or TB, 3 types of tuberculosis, how TB spreads, what happens when you inhale TB bacteria, TB symptoms, what to do when you suspect you have TB, types of TB tests. So if you have not seen my previous video, please check it out. And I will also put the link down below in the description box so that you can see it also to know more about tuberculosis. And don't forget to hit like and subscribe. So how I got sick, how it started. It actually started, I started to get sick since March 2020. It started with a pain on my back, a cough, and then I went to a doctor. Doctor said I have dry cough. Second doctor said I have acute bronchitis. Third doctor said I have asthma, allergic rhinitis, chronic bronchitis, and she suspected I have pneumonia, so I went to have an x-ray, blood test, and sputum test. However, at that time, April 2020, my sputum test is negative, so TB at that time was ruled out. Up until I've been like sick on and off since March, and I was referred by the doctor to see a pulmonologist. So I went to see a pulmonologist in October. He said that my x-ray is improving, so my pneumonia is improving also. So I just have to take some medicines for a month and inhaler for a month because of the wheezing sound. So so that the phlegm will actually go out. So after taking that medicines, November 9, we have to do some filing in our office, so I have to carry files. And when I carried a heavy file, when I sat down, I felt that my right side actually have, it's really like painful. And after a few minutes, I just felt feverish, chill. I was chilling even though the room temperature is 23 degrees. So I was actually like feeling really sick at that time. So when I went home at night, my fever is still, like I still feel hot. I was chilling, and at the same time, I was like sweating, like cold sweats also. But I did not decide to go immediately to a doctor because I was like, I've been sick like on and off. Maybe after 3 days the fever will just be gone. And then but I was kind of feeling that it's actually like too much. Like I drink medicines for the fever, but the fever actually go down low, but it's not really like totally gone when you drink medicine, you know, fever medicine. So I went to see my pulmonologist again, November 15, and when I arrived in the clinic, I was 40 degrees. I have 144 beats per minute heartbeat. And then the doctor was advised the nurses that I have to take IV medicines to actually like lower down my fever and antibiotics, because in the x-ray they found a water in my lungs, which is pleural effusion. I will discuss pleural effusion also on the next video. And he said that I have a scar on my lungs and I have to be really admitted. So at that time, I still don't know that I have tuberculosis, so I was admitted November 15 evening, and of course the hospital really needs to rule out everything to really identify what is your disease, and that way they can give you the right treatment, right? So when I was admitted to the hospital, that was the time that they did a sputum test again. So when they did the sputum test, they were really sure that I have tuberculosis. And since here in UAE, if you have tuberculosis, private hospitals don't have the medicines for you, and you need to be transferred to a government hospital that can really take care of you and give you the right treatment. Excuse me. So I was transferred here in Liwa Hospital. I was transferred here November 18. I'm still here. I'm still here because the doctors really want to make sure that I'm fully healthy before I go back home, and they want to make sure that my liver function also is normal because of the side effects of the TB medicines. So they don't want me to go back here and be admitted again. So that's why I'm here for 5 weeks already, but I'm hoping that I'll be home soon and work again soon. Tuberculosis treatment. So when you are diagnosed with TB disease, the treatment is centered on curing the individual patient and decreasing the transmission of TB bacteria to other people. There are 3 objectives of anti-tuberculosis therapy. One is cure the individual patient and minimize risk of death and disability. 2, reduce transmission of Mycobacterium tuberculosis or TB bacteria to other people. And 3, prevent the development of drug resistance during therapy. 2 types of TB treatment. There are actually 2 types of TB treatment: first line treatment and second line treatment. First line treatment is the initial empiric treatment of TB that the patient starts on a 4-drug regimen. 4 drugs are isoniazid, rifampicin, pyrazinamide, and ethambutol. So once you have active TB, or once you found out that you have TB, usual treatment is 2 antibiotics, which is the isoniazid and rifampicin, which is for 6 months, and then 2 additional antibiotics, pyrazinamide and ethambutol, for the first 2 months of the 6-month period. So TB medications or TB treatment actually consist of a 2-month intensive phase, which is for 2 months you do really need to take all 4 medicines as per prescribed by your doctor, and then it's followed by a 4-month continuation phase. However, TB treatment may take 6 to 9 months. It depends on how your body cope up with the medicine. Next one is second line treatment. Second line treatment are medicines that are used for the treatment of drug or multi-drug resistant TB. And this is the only treatment used to treat disease that is resistant to the first line treatment. So second line drugs actually include medicines which are levofloxacin, moxifloxacin, bedaquiline, delamanid, lenizolid, and a new second-line drug recommended in 2019, which is pretomanid. What is drug or multi-drug resistant TB? Drug-resistant TB is resistant to one antibiotic. It means your TB bacteria is resistant. It means that it cannot be cured by the first-line treatment, so you have to do this. Healthcare providers or doctors need to recommend second-line treatment for you if you're resistant to drug or the first-line treatment of TB. And then multi-drug resistant TB is actually strains of TB that are resistant to 2 or more antibiotics. So multi-drug resistant TB requires a much longer course of antibiotics, which is between 9 to 24 months, depending on the strain. So let's talk about now the TB medications dosage. So TB medication dosage actually has a weight-based and fixed-based combinations of drugs. However, the recommended dosage would actually depend on the patient's weight, because there are actually like some who are smaller like me or bigger, so they are weight-based medication due to the healthcare provider or the doctor would actually have enough dosage to kill the bacteria in your system. How does TB medicines work? So all the TB drugs that we have mentioned earlier can actually kill all the TB bacteria in a person's body. So this means that the person is then cured of TB. But TB bacteria die very slowly, and so the drugs have to be taken for several months. That's why it takes 6 to 9 months or 9 months to 24 months for second-line treatment in order for the medicines to kill all the bacteria in your body. There are actually 5 physical signs that the TB treatment is working. First sign is a reduction in symptoms such as less coughing, no more fever, no more chills, no more night sweats, and no more other TB symptoms. And then second one is overall improvement in the way one feels. So if you can actually like feel that you feel good, you feel okay, like me now, I feel okay, but I still have to be undergo treatment, and I still have to stay here in the hospital because they have to monitor my liver. And then weight gain, which is I gained weight already, so from 38.80 I went high to 41 kg, so two more kilograms I'll be on my normal weight. And then fourth is increased of appetite, which is for 2 weeks now I have increased my appetite, which is very good. I really want to eat every 2 hours or every hour now here. And then fifth is improvement in strength and stamina. So if you feel strong, if you feel you're okay, it means that the TB treatment is working for you. Lastly, important notes when you are still on treatment for TB. So even when a patient starts to feel better, they can actually still have bacteria alive in their body. So it is very important to first take your medicines on time and as prescribed by the doctor. Second is never stop treatment too soon or never skip doses, as it allows the bacteria that are still alive to become resistant to TB drugs, and we don't want multi-drug resistant TB. And then third, if you wanted to know about your situation and if you wanted to know how fast you can actually treat TB, please don't hesitate to ask your healthcare provider, ask your doctor, ask any information you want. In that way, you will be guided properly for the TB treatment. Fourth, commitment, which is also important with relationships. So you have to commit to long-term course drugs and always go to your doctor's appointment while actually still on treatment. And then fifth, you should skip tobacco in all forms. Don't drink alcohol. Avoid coffee and other caffeinated drinks. Avoid refined products. And avoid high-fat, high cholesterol red meat so that you will have a fast recovery and you will be healthy again. And I'm looking forward to be healthy again and to be home again and be with my family also. Hoping to be back to my loved ones and hopefully soon. And hopefully my body can just like cope with the medicines and I'll be very, 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 very healthy. So that's actually it for today. That's it for today, and I hope you guys learn a lot from me about tuberculosis, and hope to see you soon on my next video. And please don't forget to hit like and subscribe. And amping kanulay mga dudungog inay. Take care everyone. And always be kind to each other. Mwah, mwah, mwah.
That's a woman.